to Sri Tathagata Satpathy.
Thank you, Madam. First of all, at the outset, I would like to express my gratitude to our most valuable colleague, Shri Anurag Thakurji, who has in the BSc for at least the past 2 years, he had been at it that we must discuss the Sustainable Development Goals. SDG is a major issue, and in a country like India where the population is burgeoning, every year we see millions of children being born and thousands dying every day. His effort is extremely laudable that there are MPs, maybe very few because others may not actually grasp all subjects, but there are few like him who are taking things very seriously. I thank you, Anuragji, for this effort of yours, and I thank Madam Speaker and the present Chair for your patience and Madam Speaker's persistence and support to Anuragji to bring about this 193 and make it a reality. It is not that a lot of change will happen just because of all these talks that we are giving. My colleagues, senior colleagues, junior colleagues, respected colleagues, starting from Anuragji to the Congress Speaker to Saugata Babu, they have given a lot of data. So I would not like to delve into that again. And we all more or less are aware of what the goals are pertaining to health sector in the SDG window, and how everybody knows how India has fallen far behind, apart from statistics and data, which is now the domain of Anuragji's party, and nobody else dares to get into that, because that's going to be your private limited property. But apart from statistics and juggling of data, in reality at the ground level we see at the ground level that in the sector of health, India has not fared as successful or as well as all of us in this house would like it to do. Now, there are many problems. There are some which are inherent, some which are our customs, our religion, our attitude to life, and some which are man-made, which have come into our lifestyle over a period of time. For instance, I have seen, and in my family I try to go against that, my son, who's about 11 years old and goes to a school in Bhubaneswar, the pressure there on him is to study. His mother is in half minds because all his other classmates are proud that somebody has come first, somebody has come second, somebody has scored very high marks. He does well in education, in studies, but we also insist, since he likes basketball, since he likes roller skating, we tell him that you skip studies today, go and play basketball. And I am surprised and I am happy that other kids in the school, seeing him, they are telling their parents that let us go and play when they are under pressure to study. It might be a little mischievous, but in some ways I think it is good. We are not an outdoorsy race. Indians as such have never been outdoorsy, because if we would have been outdoorsy, I would not be sitting here in this air-conditioned chamber of Lok Sabha the whole day expecting a pot belly to grow. If I was in any Western country or in the US, I would probably be taking my child mountain hiking or snow skiing or mountain climbing, doing something outdoorsy, which we do not do. So that's an inherent custom drawback, a societal drawback, which we have to deal with. That is why it was said that all work and no play makes Sammy Goodring Jr. a sick person. Now go and Google who is Sammy Goodring. So when we are not outdoorsy, we have the other problems such as obesity, plumpness of this disease that happens, goiter. Goiter, and many other, by the Middle Ages, you will find many Indians have stiff joints. That's because movement is extremely limited, so ill health settles in very early in life. It is sadly, madam, for you, you would not be bothered because you are a doctor, you see this happen every time, you would be, resistant to that. But I have to admit that it is a very sad thing that I am going to say now, that all of us in this house, nobody should get angry with me, all of us in this house are going to die one day. It's a terrible news that I am breaking on this house. And I beg pardon for that. So keeping that as the ultimate goal, that one day all of us will die, what is our effort? Our effort is not only what kind of a lifestyle I lead, but what kind of a lifestyle I am able to offer to my people who look up to each one of us as an example. Have we failed as examples, or are we successes in examples? It is not only giving out the MP Lad fund for community centers, it is not only cutting down thousands of trees to build highways, because everybody talks about infrastructure. This government is so keen on economic reforms, but Nadda ji, who has done yeoman service, I mentioned him once when he was not in the house, the kind of work that he, his ministry and his secretary have done is something that needs praise. And are we actually considering any laws for social change where children will not be burdened with too much of studies, they will have time to play, where every school will be compelled, like I went to a school in Pondicherry, the Sri Aurobindo International Center of Education. There, if we bunked a class, the teachers never reprimanded us. But if we bunked what was called group, which started at 4 p.m. and it was physical activity till 6 p.m., then we were pulled up in school the next day. That was physical activity you cannot miss. So we learned swimming, we learned hiking, we learned football. We didn't have this, we did, but we were not very keen on this, Mem Saab ka game of cricket. So medicine and healthcare is something that is evolving. I remember when I was younger, there were people who used to tell us that if children have diarrhea, do not give them water. If they have fever, do not give them rice. But today, the doctors tell us that if you have fever, you have fever. Then we first thing, we who have, progressed in age, I'm not saying aging, but we are not aged, but we have progressed in age, we ask them, what can I eat and what can I not eat? They say, what is that question? You can eat anything you like, but just take your medicines on time. So, medicine also, like all of us, is evolving. And since our young colleagues are so worried, please remember one thing, that generic medicines which were started earlier, and I don't want to name a party that I never wish to name, but which was started much earlier, was something that a lot of people had high hopes on. But since the Modi government has come to power, the stress, Modi government has come to office, the stress on supply of generic medicines to states has gone down. Believe it or not, I am not making this a political issue, but please go back to your constituencies. Please check with government hospitals where they had outlets for generic medicines. There are mostly none of the important medicines are available today. So that's a sad part. And I am not reprimanding anybody. I am not pulling up anybody. I would insist the Honorable Minister for Health that he should ensure that supply of generic medicines continues unabated and in full quantity to all the states that require it, and maybe somewhere a commercial name, a pharmaceutical name, and the corresponding generic names could be put up on a board where if the doctors do not prescribe generic medicines, the educated patient at least can help somebody else that this is an alternative that you can purchase. Somewhere it could be done like that. Now, all of us are aware about clandestine agreements being made with US pharma companies. The less said, the better, because, US is US, and we will have, yes. See, he is aware about it. So those agreements are eventually going to cost us very dear. Medicine prices will go up, and in about a year or so, we will see how, inshallah, if we are alive, we will see how negative these things will be. I would like to address the question of population. Sir, I remember during emergency, the 5-point program of the then Prime Minister's son, Mr. Sanjay Gandhi, late Sanjay Gandhi's 5-point, I think your history is messed up. You do not know.
No, you please address the chair.
Yes, sir. Sir, you are my inspiration. He had made family planning mandatory, and as usual, like today also we are passing laws, we do not know how they are going to be implemented at the ground level. Similarly, he might have had a good reason, I do not know, I do not vouchsafe for anybody, but what happened was there was misuse, compulsion and forcible sterilization campaigns which were carried out, and where mostly in Uttar Pradesh, where today you cannot eat meat, you cannot have so many other things. That is not a concern. Sir, what is of concern is that put a scare in the minds of the average politician of India. And when Mr. Raj Narayan ji came as the Minister of Health, defeating Mrs. Indira Gandhi, the first thing he did was change the name of the Ministry of Health and Family Planning into Health and Family Welfare. So what has welfare led us to? Welfare has led us to allow women to have 26 weeks of pregnancy leave after the second child, after the third child, after the fourth child. That means we are encouraging women of this country by force of their family or social pressures from their in-laws to have more children. And by that, we are encouraging the growth of the population, which is finally, I
Please
find...
conclude.
No, sir, I've got quite a few points.
Yeah,
There's enough time.
Please go ahead.
Sir, I get... Sir, I am a very nervous kind of a person.
Please go ahead.
And my heart starts beating harder when you say this. So I will only request you, sir, that I will not take unnecessary time. I will quickly run through my points. So, I have only one child.
No, you are wasting time in... You have already wasted time.
So, sir...
In talking to them, you please address to me.
I am talking to you, sir. I heard it somewhere. I am getting distracted by your talks. Sir, we are talking about cleanliness. The whole country was excited. Everybody in this house thought that this is a great move, that this is a move which all of us wanted. You don't have to go far, sir. You don't have to go to Karnataka or to Orissa or to Calcutta. All you have to do is go 4 kilometers from the Parliament building near the New Delhi railway station. That side or this side, no matter where you come out from, it is full of filth. So, sir, I thought about it when I came by train month before last from Bhubaneswar. I thought about it. I said, what is wrong with our population? When a prime minister, such a beloved prime minister, so popular, so liked, is giving a call, why is society not responding to him? Is he not being heard by society? Is it somehow that they manipulate votes but the social acceptance is not there? Then, sir, I realized that the problem is very deep-seated. The problem, sir, is if I tell you to have a bath every day and then...
No, please. ऐसा मत.
Sir, the problem is if I tell somebody that you please come clean every day when you come to Parliament, and then I put a tax on him for his cleanliness. So, sir, the common man's mindset says, I am paying. If I am paying, then it is your responsibility. You clean up this place. So, sir, what has happened? It's a good move. It's a welcome move. We want on one hand that the country should develop, but on the other hand, by putting a tax, by putting a cess on Swachh Bharat, we are also giving out a message, a very subterfuge message, that it is not necessary for you to do anything. The government will do something. So, sir, you have a idea, and this is not criticism. I am not criticizing anybody. This is just, I'm talking about a flawed mindset. Similarly, in my constituency, I see how NTPC is creating toilets. And I'm naming the company. Sir, I went to some of the rural areas. One of my voters, an old lady, she had a toilet built in her backyard by NTPC. And the lady had gone to use it. And when she got up, because she is old, she put her hand on one of the walls. And those are like little cubicles. She put her hand, and that hand collapsed. The lady fell, and the other side of the wall fell on her. And she was hospitalized for 2 months because she was such an old lady. So this is not a general thing. But what I'm saying, sir, is that it is at present, we said, when we started, we said we will give them 9,500 rupees. Then we said we will give them 12,000 rupees per toilet. And then when we saw the budget, we saw that if you divide the number of toilets with the amount sanctioned, it comes to barely 8,000 rupees. Then the question is of doctors. Why don't doctors go to rural areas? So there are two reasons that I find why doctors don't go to rural areas. First is that there is no attractive infrastructure. By infrastructure, I mean they do not have homes in rural areas, first of all, where they can stay in a hospital, in a government hospital in a rural area. There is no place to stay, no flowing water, no electricity. So that is something that puts them off. And secondly, because of lack of educational facilities, their children don't get a future. So to maintain two establishments, doctors have a problem to go to rural areas. That is one problem. The second problem is there is a general feeling that if I leave an urban area, my private practice will go. I will not be in touch with the minister or the health minister or the secretary. So my transfer and posting, and this is all across in every state, my transfer and posting will be a problem. So they prefer to be in urban areas so that they have access. They can give favors when the minister falls ill. There will be a flock of doctors attending upon him. They don't allow space for the nurses. They don't give a walkway also for the nurse to go and give an injection. So the doctors want to do everything. So in a country where the MCI says we only have 9.29 lakh doctors registered, some 7 lakh doctors at any given point of time are actually available for government jobs. So it is easy to criticize government doctors. It's very easy to say they are callous, they are bad, they are cold, they don't care when we fall ill. That is because, sir, one thing I have noticed even in Orissa, doctors get assaulted. And Anurag ji very rightly said, he appealed to the nation, to every citizen, not to assault doctors. And I would like to join my voice with you, sir, that that's a very correct thing. So what I have noticed, Chairman sir, Sir,
Please
you are
address.
saying to look at you and I am looking at you, sir.
I am looking at you.
Sir.
You don't.
Sir, what I found, sir. No, I am not looking. Anurag ji is the initiator, sir. He is the fire starter. So you always have to pay due respect to the fire starter. Sir, what happens is, when you criticize a doctor, you have to think of the background. They go to very many quacks and very many half-demented practitioners. When they fail with everything, then they come to a government hospital. I have.
Please conclude.
Yes.
इसके
Yes,
बाद
of course.
सुनिए 0 आवर है इसलिए
Yes, sir. Yes,
बहुत
sir.
लोग
I will
वेट कर रहे
conclude.
हैं.
I am always ready to conclude.
आपका
Sir.
भी 0 आवर है ना?
2 minutes. Sir,
Now please conclude.
when they fail everywhere else, they go to a government doctor. The patient's relatives take the patient to a government doctor. At that time, the patient is in terrible state of condition and is about to die. So if the death occurs, which, as I said, even all of us honorable MPs will one day die.
Please conclude.
So that incites the relatives to commit violence and to do things that we would really not like to do in the case of our great-great-grandmother also. So, sir, I thank you very much and for giving me this opportunity. I thank the initiator. I thank the speaker, madam, for allowing this discussion on SDG. And I am sure that no matter which political party is in power, this country, the citizens of this country are above and over all of us, and they will become conscious, and they alone will change this country and change it very soon. Thank you, sir.
Thank you.